In today's Eye on Health, we know how difficult of a year 2020 was mentally and emotionally, and those impacts of the pandemic could really be felt for those affected by addiction. We want to bring in Dr. Cesar DeLeo, the Vice President and Executive Medical Director of Strategic Initiatives for Highmark Blue Cross Blue Shield. DeLeo, so good to have you with us.
Good morning, Heather.
So can we talk about the impact of the pandemic on the opioid epidemic?
Heather, the impact has been profound. People have been isolated and under stress. And under those circumstances, people who have had problems with substance use disorder have increased use. And not only have they increased use, but they increase by themselves and they have no one there to call for help in the event of an overdose. But with the pandemic has come a tremendous amount of innovation. We have seen practitioners pivot to the use of telemedicine services and tele-addiction services. People embrace that, and there has been tremendous resiliency in the provider community.
So how did you monitor all of this? I mean, I know that there were group sessions before all of this and counseling. So switching to telemedicine and telehealth, how do you make that switch? How do you reach out to this vulnerable crowd of people?
Well, the switch to telemedicine has been exponential. At the beginning of the pandemic, there were only a few large national telemedicine companies that were performing telemedicine, but it is now currently 98% that is actually delivered by practitioners. At the peak of the pandemic, over 90% of addiction medicine services at Allegheny Health System were provided by telemedicine. And we saw an increase because of increased access through telemedicine and a decreased no-show rate, which was remarkable. And now that's come back down, but it's at about 50%. And I don't think we're ever going to put that genie back in the bottle.
And I know that there's been so much work, grants, and working with communities to get Narcan into the hands of the right people so they can help and be there. And that does maybe prevent some of the fatal overdoses, but it doesn't address the root of the problem and trying to, like you said, we can't get the genie back in the bottle, but helping that problem.
Yes, absolutely. We have been working with harm reduction organizations across the state of Pennsylvania, offering grants to supply them with Narcan so that Narcan can be distributed, and also to EMS so that they could administer Narcan in the field. In addition, we've also supported community groups addressing social determinants of health, such as food insecurity and housing, which are important components that people need in order to have their lives in some order to be able to take care of their medical issues.
Like you said, making sure some of those stressors aren't there so there's no relapse if you can. Highmark employees have also been doing something else, peer education and advocacy. Can you tell me a little bit about that?
Absolutely. I love to talk about this. This started about 2 years ago with my colleague, Ashley Potts. It was a grassroots effort that really came about because of our own employees. And we have over 600 employees who are actively involved in what we call the LEARN program. In particular, what I'd like to point out is our promotion of a recovery-friendly workplace. And we have 5 pillars. And those pillars are to understand the use of substance use disorder or substances in the workplace, to use person-first language, which is non-stigmatizing, to recognize signs of impairment and in particular overdose and what to do. Promote HR policies that allow for a recovery-friendly workplace that is not punitive, and to support employees on their recovery journey. And for those who are in long-term sustained recovery, allow them to help those who are entering into that journey.
Really great stuff. Dr. DeLeo, thank you so much.
Thank you, Heather.
Always good to talk with you. Dr. DeLeo, as always, thanks for joining us. And remember to keep watching for our Eye on Health series right here on PTL. It happens on Wednesdays, and it's sponsored by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health.